Hi everybody, thanks for your massive interest in the annual Maturometer results. This is the 10th edition already of the Maturometer, and I think the increasing interest in this is also reflected in what's happening in the industry. So there's clearly a second coming of digital, and I will help you guide through, let's say, the current trends and the future expectations. So my name is Fonny Schenck. I'm the CEO of Across Health. Across Health is a consultancy in the omni-channel engagement space, and one of the things we do is measure the trends in the industry, which is called the Multichannel Maturometer. So I will take you through some of the questions that we put in that section. It's a much longer deck than we will actually take you through in the next 40 minutes. But there will be more data available later on, and there's always an opportunity, of course, for you to ask questions during the session, which you can do in the Q&A button. At the same time, I will ask a few questions to you as well in the poll section. I look forward to having an engaging conversation with you all. So here we go. The Maturometer is looking at 4 components of digital. I think they're all equally important. People, strategy, and organization are key enablers of digital. Business process and technology are also key enablers of digital. A lot of focus has been put in the past on the third one, multi-channel, or mainly multiple channels, which we also will cover. And the last but not least part is the evidence. Like, does this all work? Does it help us get to the next level? Does it help us beat the competition? All of those things. It's been, I think, an underutilized component, but it's coming clearer to the fore right now because people want to see what is happening. So, what does the Maturometer cover? It's about 250 people exactly, after which we cut it off, that took part in it. Most are from Europe, 40%, but we also have a good representation from US, from Middle East, Africa, Latin America, China, Japan as well. So a good coverage of the global universe. If you look at are they local versus international staff, because they do have different perspectives, it's about a 50-50% split. So national local is 47%, the other groups composed of global and regional is another 53%. So a good split of the two, because they do have different perspectives and different priorities in life in terms of digital. In terms of position, again, a good split between manager level, so more operational, and director and above. So around 47 for manager and around 43 for director or higher. Okay, so let me start with the good news. There's a lot of good news to tell. One of the key things, sorry, I was a bit quick here. The good news is certainly that budgets are rising. So digital budgets are rising. And the question to you is, if you look at the average marketing budget, what percentage of that is digital? Let's go to the chart here. As you can see, it's now 21.5%, and it follows another big wave of growth in 2017 when budgets grew 20%. So it's the second year that budgets are growing quite significantly, and this growth comes after 5 years of basically nothing. So 2012 was 14.8%, and 2016 was 15.7%. So clearly no progress in 5 years, and then in the last 2 years, there's clearly an increase coming, which of course is a good thing. Some other good things you can see here, and I'm going to first explain a little bit what I'm going to share with you. We use the Boston Consulting matrix, which looks at growth and share. And it creates 4 buckets. Stars, cows, cash cows, sorry, dogs, and question mark. I'm not going to go into detail on that one, but we're going to look into some of those buckets. So for instance, the stars are high current share and high growth. So those are clearly the things that are moving much more than, for instance, the dogs, where there's a low current share, low current activity, and also low growth. We're going to look at growth over 2 years, so 2016 to 2018. That's on the y-axis. And the x-axis is actually the current use, the current penetration, the current adoption. So for the key enablers, which, let's say you see all the dots here, we're going to look into a few of them. The average of the key enablers is 17% of adoption. This 70%, of course, is not very high. If you look at channel adoption, you will see that the average adoption is about 33%, so that's almost double as high. So 70% means in terms of, let's say, digital transformation, the average is clearly not very high. So digital transformation is clearly not something that is omnipresent. If you look at the y-axis, the growth, the average growth of the components that we will discuss in a minute is about 5% over 2 years, which again shows there is positive activities happening, but these positive activities are quite limited as well. You will see a totally different picture again in the channel adoption, I think, where the average growth is about 30% too. So the transformation typically takes more time, is more important, but is clearly behind the channel adoption. So we'll go into a few of those quadrants. And the first quadrant I will cover with you in terms of key enablers is the top, let's say, the place where everybody wants to be, which is high growth in terms of the y-axis, and also high current share. So what is doing extremely well in relative terms in digital, in pharma, are those 3 components. So strong digital multi-channel team with board support is the best scoring component. It has grown 12% over the last 2 years and is at about 30% of, let's say, respondents saying we have this fully in place. The other 2 are reps equipped with digital tools beyond the detail. This is something we see a lot, where digital transformation is seen as something around the digital rep to make sure that he's web enabled and that he can send approved email, do remote engagement, and use the tablet in the right way. We believe this is an important element to cover, but it's certainly not the full opportunity for digital strategy or transformation. And then the last one is exactly that, what I just discussed, strong digital transformation vision and strategy. It is also at 30% average, let's say, top use, but the growth there is quite limited. So these are the top 3 elements. Once again, with some caveats, because the current average is quite low at 17% of adoption, and the growth for the key enablers is also not that significant at around 5%. Another one which potentially might come into the, let's say, the high market share component is integrated customer database across channels. Interestingly, this is at about 17%, so that means 83% of respondents do not feel they have this in place, and the growth there is also only 6%. So it's a very important component of key, let's say, digital transformation and omni-channel customer engagement, but it's still at around only 17% and relatively small growth. There is no real top, let's say, what they call question mark at BCG, high growth component with low market share. There is none. Only this one is out there. Okay, we're looking at the same quadrant, but now we're looking at the channel adoption. So a very specific subset, not the main key enablers that we discussed earlier, like measurement, channel mix adoption, training, but really looking at channel adoption only. And as I said, you see a similar picture, but it's important to see also that the averages are completely different, and that means higher. So there's clearly a much faster adoption of channels, which is logical. It's easier to adopt channels than to revolutionize your organization. but it's clearly shown here in the two axes, the X and the Y axis, both are around 30% improvement for the average set of channels. So what are the key channels that have a high market share and high growth? Important to watch those and see whether this makes sense to you as well. Social media marketing, mobile marketing, I mean, no surprises there. Social media monitoring, web conferencing is growing significantly, I think, with all the virtual activities happening and the Congress activities being reduced in terms of having physicians go there. Makes a lot of sense, so it becomes quite mature and it's growing quite significantly. And also the physician self-service portal. Online medical education is quite similar to the web conferencing part as well. So these are the high growth areas. The very mature components, the cash cows, as BCG calls it, are, I think, no surprise. So the pharma website is really used by almost everybody. 85% is using the pharma website. No surprise, 85% is using tablet detailing, etc. The question, of course, is if these mature channels should be considered mature. So if we really should think that the fact that they are being used means that they're also being used effectively or not, I think that's another question that we cannot address here, but it's typically something more for the multi-channel navigator here. So quite some good news here as well, and some of the elements that might soon come into the, let's say, the right side of the bucket because of high growth is what you see here. So all very positive evolutions, and the top element there is integrated cross-channel campaigns at around 50% of people piloting this in the last 2 years, so that's an amazing growth. The EMSL, the EREP also, so clear interest in those areas. And then we have quite a few of the newer areas like the big data thing, artificial intelligence, predictive analytics, marketing automation, etc. So really hot topics in the industry, and I think very important to have a look at. Not surprised me, but what is clearly striking is that the integrated multi-channel campaign is becoming a top pilot area. Also, patient adherence tools is growing significantly and is also part of that whole new area of data and patient orientation. Okay, so a lot of good things happening. Relatively speaking, I think certainly in terms of channel adoption, there's a lot of things growing quite quickly and doing quite well. In terms of key enablers for the organization itself, there's quite a few areas too, but it's lagging a bit versus channel adoption. So I'm going to give you a little bit more bad news now, which also means that if you have not gone into this bad news and you read about it before you actually implement it, it's worth to, let's say, proactively address these things because they may indeed, let's say, hamper your transformation activities. So the first one that really is summing it all up, so all the effort that's being undertaken in terms of channel adoption, in terms of key enablers, is this really working? Are people happy with what has been achieved, with the increased budget that has been spent, 40% higher budget versus 2 years ago? So all of these things would look like, yep, should be much better. In fact, not. So 17% of the respondents said that they were happy or very happy with the current activities in terms of digital. This number is very similar to what we had in the 2012, 2013, 2014 period. So there's not a lot of progress yet. So you might say, well, this is quite sobering because the investment doesn't pay off. There is a little bit of light, though, in the sense that if you look at the other two parts, the dissatisfied and the neutral part, you see that the dissatisfied group is becoming smaller and the neutral group is becoming bigger. So there is clearly, I think, a slow movement towards, let's say, less dissatisfaction, higher satisfaction levels going forward. So that's what we expect to see in the future as well. If you look at the two axes that I shared with the BCG one, where I said the adoption of transformation is actually slower than the adoption of channels, you see that reflected here. So the pace of digital transformation is still seen as very slow, and we looked at two groups here. We looked at national groups, so the local teams, and we also looked at global groups. So it's a bit higher in global groups, who tend to be a bit more impatient, apparently. But in both groups, it's about 50% to say slow to very slow. There's 2 to 3% to say fast to very fast. It would be interesting to explore what they mean with that. Okay, one of the things we also typically look at year after year to see if those change is the hurdles. So there, if the budget is higher, if the capabilities are higher, then why would it not be easy to actually get higher satisfaction rates? Well, there may be a few hurdles here, and this is a chart that we typically look at every year. It's also a good thing, in fact, that the legal or the MLR issues tend to be highest and also tend to increase. I tend to see this as a positive sign, meaning that people start implementing digital and they start to really feel the issues that this may achieve. So when I look at companies that are totally under leveraging digital, they don't see an issue with MLR because they really don't practice it. The more you practice it, the more you see the issues, and of course, the more you need to address them. So I think it's a positive sign. It's a fact of life to take them into account, and I think it shows the increased interest as well. ROI questions is the highest growth in the last couple of years. I think for a very simple reason, senior management is now back on board. They know that things are happening. They hear things about the competition. They hear things about customers. They know they want to spend more. They don't know where to spend it, and they want to see the results. So showing more evidence for what's being done, I think, is important in this space to make sure that the second coming of digital actually is going to be successful. The other elements are still quite key, not enough internal knowledge. We'll come back to that in a second. It's dropping a little bit versus 2 years ago, but still significant. And the lack of strategy is also in that same group, same category. If we look at the sales group specifically, so we've taken out sales and medical separately. What are the key hurdles they see there? It's quite similar. It's not so much MLR, of course, in sales. It is in medical, but the lack of training and skills is number one, and the lack of strategy is number two. If we go to medical, it's again strategy, now number one. MLR, I think no surprises in that group. And then number three, again, is lack of training and skills. So strategy, skills, MLR, those things come back in different, let's say, priorities, but they're all very similar across the board. So we talked about the positive things, and I think I now need to go to a new Q&A, sorry. So what is the top transformational enabler? High share, high growth. To reflect on what we just discussed, is it a strong digital team? Is it campaign automation? Is it staff well-trained in digital? Or is it a robust process for channel mix? Indeed, it's a strong digital team with board support. Once again, also saying that it's only 30% of companies that have this in place. The other ones are in the doghouse, as I call it, so we'll discuss them in a second. They are indeed not, let's say, the top performing areas in the key enablers. So this is where we are. The doghouse, you can see to the bottom left, sorry. These are all areas that have limited adoption, lower than 15%, and many even lower than 10%. So staff well-trained in digital has an adoption of about 7%. That means 7% of the respondents say, we have this in place fully. And since 2016, that dot has not changed much, only 3% actually growth versus 2016. So it's of course quite difficult to train everybody on a very evolutionary and revolutionary sometimes area like digital, but it's clearly reflected in the numbers here as well. Surprisingly, a bit, I think, was the good view of channel HTTP, good view of HTTP channel acceptance is still below 10% of, yes, we feel very comfortable with that. And it's only growing by 3% in the last 2 years, so there's not much progress being made there. And the key enabler or the key barrier, I think, to making this all work, robust process and channel mix is the lowest of all. So 7% says yes, we have this in place fully, we are confident, and only 2% growth in the last couple of years. The measurement part you see to the, let's say, towards the median, so the good mix of qualitative and quantitative, and measuring HTTP channel engagement is still quite low and is not growing, let's say, significantly either. And the digital multi-channel team integrated with the business and IT is at 18%, 18-19%. So that means 80% feels they have this well done well, the integration, but the growth there is quite small as well. So quite slow growth into this space, which is quite key to making things work. So this whole dog and cash cow space is really important, I think, to address as quickly as possible, because these will define whether or not the budget that will be spent is actually going to be spent in the right way. So talking about training and knowledge, this is a chart that we, let's say, produced based on, let's say, a sub-analysis where we looked at the level of understanding of digital, and we looked at two groups. We looked at the marketing group, so the marketing respondents in the survey, as well as the people who, let's say, stated they were digital or multi-channel, let's say, project managers, whatever, to the survey. So you see that marketing here has 6% who feel they are an expert. That 6% is exactly the same number as we had in 2010, so it doesn't change. It's been lower, it's been a bit higher, but it's actually still quite low, and we're 8 years since 2010. Potentially even more surprising is the fact that the digital multi-channel leads, who the marketing people who tend to be blind a little bit, or at least one-eyed, depend on. So the marketing people depend on digital multi-channel people to help them achieve success. Even that group is only 21% says that they know very well what digital is all about. 35% says yes, I know enough of it, but that means about 50% does not. So this is a really, in terms of capabilities, marketing needs to fully understand, at least to the level that they need to understand it, what it is that they should be looking for, what good looks like. But also the digital multi-channel team should have higher scores, I feel, on this topic. So quite revealing. If you then look at another request or question that we have, which is, to what extent are you happy with your digital global or regional teams? I think about 85% of respondents says yes, we have one. If you then ask, do you think they are successful? Only 44% of the global multi-channel teams, so the teams rating themselves, feel that they are highly effective. That means another 50% of the same people actually leading the change there feel that what they're doing is not making any impact. If you then go to see what, let's say, local teams think of what they receive from global or regional, that's quite, I think, striking. Only 17% of the local non-digital staff, that means marketing, medical, and sales, feel that it's highly effective. The local digital team, 14%, so let's call that same. And then the other extreme, the lowest score of all, is the peers of the global digital teams, which is the global non-digital groups, so the global marketing groups, global medical groups, global selling groups, whatever. There you have a 9% score. So there's clearly a need for a good governance in this space. I think other industries have done this very well. Pharma has these resources in place, but let's say on average, there's quite a lot of opportunity to improve there. And that's very much to do with governance and making sure that everybody's doing the right things and not duplicating efforts. About duplicating efforts, one of the key things is content. So if Global is producing content for digital channels, this is being adopted. But clearly, in this case, less than 50% is being adopted by over, so 65% is not adopting over 50% of the content. So that means a lot of the content that's being produced is not being used. I mean, no surprise, but the numbers are quite high, and even 30%. That's the black box. 30% even does not receive any digital content. So 65% uses under 50%, and 30% says we don't get anything at all. So once again, I think a key investment area, both the global teams as well as the global content development. But there's clearly something inefficient taking place here. And these numbers, I think, are useful because they validate what we feel in terms of gut feel as well. Okay, then looking a bit further into the future, we've looked particularly at elements around physician activity. And of course, it is a multi-stakeholder world. So the multi-channel rep was, as you may recall, quite high in terms of adoption. All these channels are quite high in adoption, the tablet detailing, etc., are quite high in adoption. Is this really reflecting, or let's say proactively focusing on where things are going? Not particularly, I would say. So this is, once again, I think a trend that we all know, but I like the chart from EY, where they say the future really is going to be with patients, with providers, with payers, policymakers as well, and then what they call, interestingly, other sectors, which they mean being big tech, the Googles and the Apples of this world. So this is where things are going, patients, more payers, more other sectors, being health tech, healthcare innovation, all those things. These will come more into the fore. And if you then ask the 250 respondents where they spent the budget, the digital budget on today, you see this picture. So Europe, US, and global. We've asked the question twice: where are you spending your budget on today? Digital budget, particularly, not general budget, digital. And where are you going to spend it 2 years from now? What strikes you first is that the US is, of course, having a more balanced view with patients and physicians at about 45-45. That stays about the same, although there's an increase in payers, so that's a good thing. If you look at Europe, the change is happening slower. So 23% spent on patients, and I think that's actually quite high looking at what we see in the market space. I think it's lower, and for Europe in 2 years it's growing, but not significantly. So the multi-stakeholder approach, which is important if we believe that the EY trends are going to happen, is clearly, let's say, not fully developed yet. You do see that payer is getting more attention. You do see that patient is getting more attention, but it's not to the extent that you might imagine could happen. We see the same thing here in terms of, let's say, where do you see the big things happening in the next 2 years. It is not in those spaces of multi-stakeholder. It is not in the space of the Googles and the Apples of this world. It's clearly around the HCP still, which is important. I'm not saying it's not important. It is important. It should be done, but it risks getting people becoming a bit myopic and focusing only on that part. I think there's a lot of opportunities in the spaces with the arrows, which are, let's say, not top priorities right now. So digital health, AI, e-medical, patient centricity, healthcare disruption, all of those things are quite key, but then not to be a strong focus area for most of the respondents. This really, I think, beautifully illustrates that as well. So the focus on the short term rather than the long term, what we call the day after tomorrow. So there's today, there's tomorrow, which is 2 years out, what we saw just now, and then there's the day after tomorrow, which looks at the longer term future. So if you look at the day after tomorrow, is pharma ready for this? 2 questions. First question, do you think this is important? These digital technologies, will they change the industry? That's the question to the left. 93 to 95% of people, depending on whether they were national or local or global, say yes, this is really going to have a very important impact. So that's a huge number. And then if you ask the question, are you getting ready for this? Are you adequately preparing for this? The score is much lower, 32 to 43% that is adequately preparing for something they feel is really going to hurt or help, if depending on how you position yourself as a, let's say, an early leader or a laggard. So it's quite limited. So there's a big opportunity, big risk as well, and let's say less than 50% of companies is adequately preparing for that. Also a bit of food for thought, I would say. Okay, I started to get a few questions as well, so we'll come to that in a second. I'm not going to go into the detail here, but in the deck that you will find on SlideShare, you'll get the full picture. I trust that I've been able to guide you through what this all is and why the 4 quadrants are what they are. So this is channel adoption. You get the same for transformation enablers. And to sum it up, this is something I really like. This is a chart from a very, I think it's quite old. It's about 100 years old. It's very simple. It has nothing to do with digital. It has everything to do with change management. And when I look at pharma companies today and look at the Maturometer results as well, you see that there's some of these things are happening, but not all 4 at the same time. And change management, according to this theory, requires that all 4 components are addressed at the same time. So the need for change needs to be there. If there's no need for change, if people feel okay with what they're doing and whatever, if there's no burning platform, as we call it, change will be slow, as you can see on the second line. If there's no clear vision and goals, if people want to change but they do not know where to go and how to go about it, if there's no strategy, no good strategy, no strong strategy in place, people will go in different places. And that's what we call lack of coordination. That's the third line here, because there's no clear direction. So everybody wants to change, but they don't know how. So they don't know how, they don't know where, etc. Third component is frustration. So if you know that there's an issue, if you know that you need to go in a certain direction to address the issue, but you do not have the budget, you do not have the people, you do not have the technologies and whatever, this leads to frustration. So not a good solution either. And then the fourth part, and I think that's really related to ROI and evidence, etc. If you take too much time to actually develop the strategy, to develop the enablers, to roll out platforms, to train everybody and all of those things, but never really put it in action, some of the key people will get impatient by all of the money being spent without visibility for results. And I think also some of the local business leaders will have the same reflection, like, so what does this all bring to me? So making sure that you have a concrete first step, some really good, well-metricized programs that show a shift from A to B, pre and per and post, I think is quite key. So summing it all up, if you have in your digital transformation those 4 key ducks in a row, I think you will be successful. Very often we see 1 or 2 missing, and that will lead to one of the let's say, elements that you see to the right as well. So this is something I even 11 years ago, I think, when I was still at Janssen, something I learned, and it's something I really think is very applicable to where we are in terms of digital. So this is the, let's say, the text version of what I produced today, so you can read it. I'm not going to take you through it, but you will once again have it in the chart. If you want to run a digital maturity assessment for yourself, we run those programs. So you have the contact name here. We're running actually a few big ones this year. There are quite a few data sets available that you can benchmark against. So feel free to reach out to us on that. If channel affinity is a key concern, which is a key concern if you look at the enablers, we can also help you with that, of course. There's the navigator for that for physicians, patients, and payers. And finally, the whole field of training. We offer a wide range of solutions there, going from the book that we just produced over workshops, over a guided tour with the healthcare disruption tour, as well as a multi-channel game, which is coming up soon. So there's quite a lot of things we can help you with, and this is also, let's say, quite popular in the industry. I think it's important as well. So that brings me to the end of the session. I will have a look at the Q&A and then address those questions. So Katerina Brule asked on slide 11, are the pharma-owned websites branded or unbranded? That's a mix of both. And there's a few people raising their hands as well, so please bear with me for a while. It's both, and so we do not make a distinction there. So we used to have product website, disease website, and company website. We stopped doing that because it gave the same kind of result there as well. On slide 16, how do you recommend to show ROI in countries where HCP tracking is not possible? There's a lot of ways to do that. So to track engagement, even at the prescription level, so grouping customers, let's say creating clusters of customers is possible. So not at the doctor level, but at the group level is possible. You can also do let's say leading indicators like prescription intent, etc. So there's quite a few things that can be done there. Once again, happy to explain that further. If you send me an email, happy to talk further on that. Christoph Wedemeyer asked, is there any observation on differences in multi-channel across therapeutic areas? Are there faster adopting ones? Probably yes. I do not have the, let's say, the numbers on that. What I do have on the other side is, if I look at countries, let's say there are certain countries where pharma is not doing a lot, and that then is almost the same across companies. There's countries like Spain, for instance, and Italy and Brazil, where there's clearly a competition between companies because they see each other doing things and they start to, let's say, add as well. I'm expecting to see the same in fields like oncology, etc. We've not looked into that specifically. We have, I think, a lot of respondents from the oncology space, but oncology, of course, is a broad space too, so not all of it is really highly competitive. Some of it is. So we might look into it, but it's clearly the case that some physicians in certain therapeutic areas get much more attention than they do in others, and in some countries it's the same. So there's clearly going to be differences there. Okay, Bozy, what about virtual conferences? I think the online conference we covered, so that, as far as I know, is being covered. High growth and high penetration as well. So if you look at the deck, you'll see that come back. Okay. How do you part of your consulting? Okay, that's something else. Sylvia, if you want to reach out to me, let me know. We can cover that offline. When you said other channels, you mentioned Google, not SEO, Apple, etc. What did you mean with that? Okay, in short, These are part of what I call the future healthcare innovation, healthcare disruption. They're coming in big numbers to try to now get into the healthcare space, particularly in either the logistics space like Amazon, or in, let's say, creating patient-focused, data-led approaches that may help or even hurt pharma. So that's a big piece of things, but they're clearly, I mean, they see that healthcare is a big business, and they see that pharma is not really focused on patient-specific data and patient connectivity, and they're entering that space increasingly. Okay, Paul. Okay, did you ask a question whether companies have a separate MCM teams or whether they are embedded in sales? No, Paul, we didn't have that question in. I'm happy to talk you through that later on. I think it's a matter of maturity as well, and about speed. So some companies just start doing something and they typically will do a centralized push down approach. Some other companies are more mature and have them well integrated in sales, marketing, medical, but there is I think no clear trend. I think it's mainly to do with maturity, but even then. Okay, do you have any info on how HCPs feel about digital maturity in the pharma sector? Yes, we do. I can give you the number for HCPs by heart. We have it for patients and payers as well, but I don't know that by heart, unfortunately, but let me know if you want to have those data. So physicians in Europe, for instance, EU5, only 33% of physicians is satisfied or very satisfied, but mainly satisfied. So not a lot of them are very satisfied. Only about 30% in total are satisfied with the digital in pharmacy. That means 70% is not. The number is quite similar for patients and for payers, although all of them indicate the opportunity. ROI of social media marketing, I think we need an extra hour for that. I'm not going to cover that now. Nadia, do you have extra recommended slides of this formula for ROI? Nadia, please reach out and we'll send you something. Carlos says thank you, and Mario, how comfortable marketing people feel on analytics and leverage. I'll also address that question separately. The question was around how comfortable marketing people are on using analytics and leveraging data for decision making. So we have a few questions on that. I didn't cover the whole question set, of course. It's about 50 slides, but we do have some data on that. Yasmin, slide 17, why do many people feel digital teams are not effective? That's a good question to ask, Yasmin. We didn't probe into that. Maybe it's something we look into in the next year. I think this is it's a key trend or a key factor. There's a lot of budget being spent on those things. So some companies are doing it right, I'm sure, and other companies should be able to learn from how to do that. I don't have the answer to that. I'm happy to discuss that maybe over the phone or whatever, but I think for me, it's what I've seen, so that's just my personal observation, is that it's very difficult as a global team to, certainly a global team, to work with all of the, let's say, all of the countries, which of course that's impossible to start with. But even the key countries, because some of the key countries themselves say, well, actually, I can do it myself. Like the big markets, they will tend to do things themselves if there's no clear governance from the business. And the small markets are too many and too varied and in two different states and too many regulatory issues to actually get, let's say, real support from global in terms of day-to-day execution. So there's quite a lot of things that could go wrong. And very often it starts with communication and priorities, like what are we expecting from them? What do we all agree they should deliver? Is that pilot? Is that technology? Is that change management or whatever? If there's agreement on that, I think it becomes easier. If there's no agreement, the potential task they have on hand is way too big to manage, and there will always be dissatisfied people or non-believers who use that opportunity to say, well, I didn't get what I want, and I ordered this, and I didn't get that. So it's governance, it's making clear that what is being done and what can be done, what cannot be done, all of those things to make it successful. Okay, Francisca. Okay. All right, thank you, Francisca. And then I'm going to the chat now. Anything else? Yes, okay, we have that. Okay, all right. I think that brings us to the end of the session. I hope you enjoyed it. I always find it a bit like reading the tea leaves. You see a few big trends happening. You see some other things that are not going according to plan, like satisfaction levels, or let's say some of the key enablers that are really lagging behind. There is no right and wrong here. I think you can all use some of this information to make sure that your digital transformation avoids certain pitfalls and goes in the right direction. I hope this has served that purpose. And thanks for those of you who contributed to the survey. The free survey, people get results back. So it's very important for us also to get a good number of respondents, make sure that the results are reliable. So thanks for that, much appreciated. And for those of you who asked suggested questions or attended the webinar as well, thanks for attending. I think it was a really useful review as well for me, and I hope you enjoyed it as well. So thanks and good luck. And if there's anything more, feel free to reach out to me or Edward. So happy to engage with you after that. Thank you very much. Have a good evening, and bye for now.